Hi, everyone. Welcome to the 2021 season of IPHA's Third Thursday Lunch and Learn web series. My name is Lena Tucker-Reinders, and I am the Executive Director of Iowa Public Health Association. And we are so glad you're here to join us today to learn about the results of the 2020 election, what that means for Iowa's legislature in the coming 2021 session, and maybe some insight of what we can expect when it comes to public health and health equity. We are excited that so many of you have joined us today, and we are happy that Deborah Thompson, who is our Advocacy Committee co-chair, is with us on the call to present her, to share all of her knowledge and wisdom with you. The Third Thursday Lunch and Learn is a monthly series that happens, as you would guess, on the third Thursday of every month at noon. It is organized by the IPHA Education Committee, and we dedicate this time every month to sharing our successes and even some of the detours that we've taken along the way to get here. The point is to connect, to learn, and to strengthen the voice for public health in Iowa. We're glad you're here and hope you'll be back with a friend next month. As I mentioned today, we're talking with Deborah Thompson, who is president of DHT Consulting, and we are fortunate that she is also our advocacy co-chair, as we said. I'll turn the screen over to her in just a few minutes, but first, a few housekeeping items. Your microphone is muted, and your video looks like some of you are on or some of you are off, but we'll like to keep your mic muted while Deborah is presenting. And then when she's done, we'll open it up for Q&A. You can type your questions in the chat box, and I will be fielding those and pitching them to her. So she said she's going to leave quite a bit of time for Q&A because I think there'll be quite a bit on here. The session is being recorded, and we will post it to the IPHA YouTube channel. And just as a reminder, Iowa Public Health Association is a membership organization. We're a nonprofit organization. Our mission is to unite and strengthen the voice for public health in Iowa, and we have been doing all that and more this year. Thank you to those of you who are on the call who are members of IPHA. It is through your membership that we are able to fulfill our mission. And to those of you on the call who are not yet members, we look forward to welcoming you to join IPHA and to become an active member. So with that, I'm going to turn it over to Deborah for her to do more of an introduction to her and her work, her background, and then talk to us about the coming session. Deborah.
Share my screen, get us started. So hi, everyone. Welcome to a public health call to action lunch and learn edition. I did a version of this presentation on our advocacy training day back in November. Thank you, Lena, so much for having me on. As you said, my name is Deborah Thompson. I own DHT Consulting and Training. We support advocacy related needs of our clients. Today, I'm wearing my IPHA volunteer hat, though. I'm a proud volunteer of this organization. And as you said, I'm the co-chair of the IPHA Advocacy Committee. I've been a member of IPHA since 2014, and I am just extremely proud of us in the way that we've grown and matured as an organization over the years, but especially in 2020. We've had a pretty amazing year despite all of it. In the time we have today, I'd like to celebrate our successes with you as they relate to advocacy and show how we're building influence as an organization. We'll watch a short video on the legislative agenda for 2021 that IPHA has prepared. And on behalf of the Advocacy Committee, I'll ask for your help with our advocacy efforts that are on the horizon during session that begins January 11th. And this includes participation in the Day on the Hill activities scheduled virtually for February 1st through the 4th. It's really a week. I want to begin with a plug, though, for the Share Public Health podcast series. If you haven't heard of it, please check it out. Hannah Schultz is the producer of the podcast and volunteers as the other co-chair of the IPHA Advocacy Committee with me. Hannah works for the Midwestern Public Health Training Center, who partners with other states in our Midwestern region. So think MINC, Missouri, Iowa, Nebraska, and Kansas. So wearing our professional hats, Hannah and I worked on a 4-part advocacy series for Share Public Health. The series covered different aspects of advocating for public health in the Midwest. As we interviewed public health advocates from all over the Midwest for the series, and by the way, 3 of the 4 episodes have been released and are on the website or wherever you get your podcasts. One of the themes that came up over and over again was how critical as public health advocates it is to reflect on small victories. So as far as advocating for public health, IPHA has had many of those small victories this year, and I'm going to take the advocates' advice and celebrate them. So for one, Lena, our beautiful and talented executive director, has been a media darling this year. It's clear that the politics of the pandemic have limited what our hardworking and dedicated friends at the Iowa Department of Public Health may candidly say about the COVID response. And so that's why it's critical that Iowa have a strong voice in its public health advocacy arm, and that's us at IPHA. So we became the go-to resource for transparent information and analysis about how the state and national response is measuring up to the public health practices that have proven to be effective in the past. So this is not our first rodeo in public health. There have been other global pandemics, but I don't think that any response has had the political landmines like this one has. So IPHA's role quickly became and continues to be valuable and critical to assuring accountability in the pandemic response here in Iowa. So in each opportunity, Lena has presented factual, evidence-based information for Iowans to balance against clear political spin. The list of her opportunities to clarify what's politics and what's science has included quotes in The Atlantic, CNN, KCCI, the Des Moines Register, Minnesota and Iowa Public Radio, and The Guardian, just to name only a few. We've also had a series of events to help legislators understand public health in Iowa and to help IPHA members and friends of IPHA understand the importance of their role as advocates in for public health and as public health professionals. So for the advocacy training, we had, I think, 50 or 60 participants. We shared the goal to change the culture of speaking up for public health to help public health professionals understand that it's not acceptable anymore to allow the lack of disease or injury to speak for itself. You know, there's this outdated and antiquated adage that public health is working well when it's silent. I think we took that a little too literally. So we need to think of the education we provide about health issues as advocacy. Education is advocacy and vice versa, and embrace it as part of what we do in our daily activities. So this includes educating elected and appointed officials about the health issues their constituents are facing. A quarter of the legislature turned up for the legislative primer we held back in November, and they stayed the entire time. They didn't drop off. IPHA has taken advantage of their thirst for public health knowledge. And so with your membership, your donations, and your continued support, we can continue to do more. If you're not an IPHA member yet, please consider joining. Because remember that IPHA, like all membership associations, works on economies of scale. We collect dues, we collect donations, and those contribute to being able to fund efforts like these. In return, the profession and practice of public health, the practice of prevention, and the practice of population health is supported and appreciated by decision makers. It's clear that Iowa public healthers need more love and appreciation from these people, in my opinion. Continuing on with what our victories were this year, the Advocacy Committee developed a candidate survey. We had a lot of lessons learned about politics and timing on this exercise, but it was all valuable. We also developed a mask mandate toolkit for local boards of health and administrators to use locally. The IPHA board published a joint statement with the Iowa Medical Society asking Governor Reynolds for a statewide mask mandate, or to at least not interfere with any local ordinances that may pass. The board also developed an anti-racism statement as well. IPHA noticed a gap in opportunities for local public health administrators to talk with one another candidly in a statewide manner about the response. And so we started convening them as a group, and it's proven to be something they value for support, moral support, ideas, and to compare notes on the response and to share best practice information. So we're hoping this becomes a regular practice even after the response is in its twilight phase. Finally, IPHA noticed a gap in response to anti-vaccination efforts happening in Iowa. So we built a coalition of public health, healthcare, nonprofit, industry, and family advocates that are ready to go to battle for the health of our children and families this year in the legislature. We would encourage you guys to check out Iowa Immunizes, the coalition, if you haven't already. And you can find out more information at www.iowa.immunizes.org. And Lena, if you don't mind putting that website in the chat, that'd be awesome. We have friends in other state coalitions, and although we're a young coalition, we're only a year old. I think we're celebrating our first anniversary this month. We've been so productive that we've become a resource to these other states. We've held 2 very well-attended legislative webinars to educate legislators on vaccines in Iowa and the COVID-19 vaccine development process. We've also created several resource documents that can be found on the website around vaccine hesitancy and Iowa trends. And finally, we've created district level one-pagers for all 150 legislators who'll be part of the incoming 2021 class. If you plan to talk to legislators about immunizations, be sure to ask us for this information because it will absolutely add value to your message. So when we think about the priority level that advocacy has in the IPHA strategic plan, it's number 2 over here in the infinity diagram. And when you think about the advocacy committee, our vision statement, which is to cultivate influence by empowering IPHA members to advocate for the adoption of public health policies that remove barriers and lay a strong foundation to living a healthy and thriving life in Iowa. Okay, that's pretty long when I say it out loud. Anyways, those 2 statements, IPHA is absolutely walking the walk and talking the talk, and we're building influence. So this organization is a worthy investment of your time, attention, and your resources. We have momentum going into session, but it's definitely going to be a tough one. Public health will have a spotlight, and we have the opportunity to take advantage of it. Hopefully we'll continue to raise our voices to educate our elected officials and to fight for resources and the positive attention that we deserve. To briefly summarize the 2020 election results, Republicans will have a continued trifecta. This means they will continue to control the House and the Senate chambers as well as the governor's office. So we really need to build more conservative allies in the legislature because the number of new legislators in general, mainly Republicans, we have the opportunity to reintroduce ourselves, introduce ourselves, and to provide education to them. 1 in 6 legislators will be new faces this year, and already many of them have been attending IPHA offered webinar events. So they're interested. Let's talk to them. I think that personally, public health in general has to do a better job of talking to conservative policymakers, especially if we truly believe that public health should not be political. And if that's the case, we need to balance our outreach efforts, because we have to remember that there's always going to be someone to fill the gap of information that lawmakers are looking for. They're seeking out information. So I would encourage us all as public health professionals, not just IPHA members, to fill the gap with our own voices. In my opinion, I think that there's a skewed membership of IPHA in the highly populated and more liberally minded areas of the state. We want all of you, plus more. But we also want your rural conservative friends too. Public health is a small community in Iowa. We cross paths at conferences, webinars, boards, task forces. We have contracts with each other, and we have projects in each other's areas. So let's make it a point to reach out at those times to rural friends, conservative friends, and ask that they learn more about advocating for public health in their areas and becoming members of IPHA if they aren't already. So IPHA is here to help with that. Send them our way for more information. So this session, we'll be pushing an ambitious legislative agenda to increase resources received directly for local public health agencies. We also want to see an assessment done on the entire public health system in the next year or 2. This is in addition to the program alignment analysis that's being done between IDPH and DHS. Finally, we'll continue to register for in support for bills that are introduced during session that promote health, reduce health inequities, and protect groups that have been socially or economically marginalized historically. It's my personal hope that in the next year or two, we can afford to have our own lobbyists supporting public health efforts at the State House. Because of the breadth of public health issues discussed, there's no way Lena can do this alone. I think there's a common misconception that somehow Lena, as our executive director, can be the point of contact for all public health issues that get discussed in the legislature. And trust me, I was the legislative liaison for the Iowa Department of Public Health for 7.5 years. And I could have used another half an FTE to address all of the public health and social determinants of health issues that were out there. So I'd like to show y'all a video that we've developed. I'm gonna make sure that it actually share sound about our legislative agenda to provide more details about why we feel these points are important. So thank you for listening. And it's geared to our legislative audience.
Thank you for taking the time to respond to your constituents' requests to watch this brief video. Your public service is sincerely appreciated, and it's definitely something that you have in common with public healthers across Iowa. We, like you, are proud of our state, love our communities, and want to see a bright and healthy future for our children and grandchildren. The Iowa Public Health Association's 2021 legislative agenda has 3 main components. First, we'd like to see increased funding for local public health agencies so that they can increase the capacity they have to do the work to improve community health. We'd also like to see an assessment of the whole public health system to realign purpose, mission, and to maximize capacity of all the major players in our state. And this includes the College of Public Health at the universities, the Iowa Department of Public Health, the State Hygienic Lab, and of course the local boards of health and local public health agencies, including those that are embedded in hospitals. We need to understand what we currently have against the national standards for operating successfully in the 21st century. Finally, we will support any policy idea that promotes health, reduces health inequities, and protects groups that have been socially and/or economically marginalized. So diving deeper on these agenda items, we'd like to see an increase of $5.3 million in state appropriations that flow directly to local public health agencies. They've seen a gradual chipping away since FY 2007, starting with the Great Recession, but their responsibilities haven't declined. This amount would restore them back to those levels, plus add consideration for inflation. The role of local public health is critical, as we now see from the pandemic. But COVID has also shown us that we don't have the capacity that we really need to be successful locally. Beyond the pandemic lies their normal responsibilities too. And right now, they're gearing up for one of the most important ones they have, the new round of community health needs assessments and health improvement plans, called the China HIPs. If you're unfamiliar, every 5 years, local public health agencies conduct their community health needs assessments. The information they provide helps inform the Healthy Iowans Plan. A side note here that the hospitals are also required to conduct their own community health needs assessments called CHAs. Depending on the community, the China HIPs and the CHAs overlap. How confusing, I know, but we're most familiar with the work that public health does, and so that's what we reference. Right now, local administrators are actively surveying individual members of their community, local organizations and nonprofits, sister agencies in government like law enforcement, and other sectors like business and healthcare. Their plans are due to the Iowa Department of Public Health in early 2022. What they produce is intended to be a reflection of the eminent health issues of their community. They will then be expected to use the plans to guide their work locally. For some county health agencies, surveying the community and compiling progress reports are all that's ever done. There are many reasons for this, and it's not a blame game, but it's disappointing because it's a missed opportunities for their residents. For other agencies, their China hit becomes a rally point to get different influencers in the community involved in solving the issues that are creating vulnerable populations, decreasing the productivity of their workforce, and therefore decreasing the attractiveness of their counties. People don't want to live in unhealthy areas, and businesses won't move to communities with an unhealthy workforce. Now, the disparity in the use of China hips as a community health beacon is one of many issues that Iowa's public health system has. We don't think it's fair to say that the system is broken. There's way too much good work being done. But what we really need is an assessment. 20 years into this century, it's hard to say that we can meet all of its demands. Interim Director Kelly Garcia is already looking at program alignment between IDPH and DHS. We want her to go further and look at the system as a whole. All things in public health start with assessment when possible. And an assessment would ask the questions, do we have the manpower, the expertise, the leadership, the skills, the data systems and data collection processes, and most importantly, the relationships to achieve better health outcomes for all Iowans. Now, some of you may be wondering, why public health? The public health purpose is unique. No other sector has the mission and vision to improve the health of all lives. That's what population health means to us, the whole population. Hospitals are concerned about patients, businesses are concerned about their customers and stockholders, insurance companies, both private and public, care about their enrollees, and so on. Public health takes the sum of all of those lives and wants all of them to have the same opportunities to be healthy and prosperous. This is a unique purpose. Forward-thinking public health leaders are convening across all sectors to help all lives all over the country and even in pockets of Iowa. In these best practice scenarios, public health plays several key and critical roles. Public health diagnoses, cooperates, and prevents. Public health experts diagnose the health of each community by listening to people who live there, and then they use data, evidence, and research to offer their solutions. That's what's happening with the China hips right now. To improve the health of the community, different organizations have to work together. Schools, businesses, government agencies, and more. Public health brings them together to make decisions and take action. Right now, we need to do more of this in every county in Iowa. We often end up in the doctor's office after we're sick or injured. Public health experts investigate everything that affects our health, food, water, air, and more, to prevent health problems before they start. And we absolutely need to do more of this. We spend way too much money on the healthcare system right now, and Iowans are not getting healthier. Public health is the missing link needed to take on the questions that will inevitably come up during the China hip process. As mentioned before, leadership is happening in pockets in Iowa, but even the best leaders can only do so much without a system to support them. And Iowans are being shorted, and the consequences are severe, like a reduction of years lived, which is also an increase in the number of years lived without a family member at Christmas. And that grief heavily impacts people whether they say it out loud or not. Another consequence is a reduction in the quality of the years we live, which is also an increase in the number of years lived with the costly and emotional burden of disease or injury. All over Iowa, it's common to see significant differences in the range of expected years of life from one census tract to the next. The data shown here comes from the Robert Wood Johnson Foundation's interactive map on life expectancy. Depending on which community you live in, you could be outlived by members of another community, even though you live in the same county or even in the same city, by 5, 10, or even 20 years in some cases. We're talking about disparity in life expectancy in places that are only 20, 30, or 45 minutes away from each other. This map looks at the top 5 and bottom 5 of our state's county health outcomes according to the Robert Wood Johnson Foundation's county rankings. All of Iowa's 99 counties are ranked from healthiest to least as compared to each other. Even in the top-rated counties, there's a difference of over 10 years or close to it. Bremer County, for example, has a gap of 13 years, and it's one of the top 5. In Wapello, one of the least healthy counties, it's a difference of 14 years. In the end, we're all Iowans, and this is not fair. Not because life is supposed to be fair, public healthers are not naive, but because we have the tools to change it, and they're not being distributed in a way that maximizes impact, and that's not fair. Collectively, we're all doing worse in regards to our health. Two credible rankings are showing the same downward decline in the health of Iowa citizens. Now, it's not all doom and gloom. There are some things that we do really well in our state, but there are some things we aren't doing well, and we haven't plummeted to the bottom half of the 50 states in the union yet. For example, we don't have as many preemie babies as other states, and we have slowly decreased our adult smoking rates. The work on the mental health system is showing up as a positive shift too. These are great things. But we do have a high rate of obesity, we have a high rate of excessive drinking, and again, we have a lot of disparity relating to health outcomes around the state, and this is not good. As we know, these health outcomes are connected to social determinants of health and oftentimes whether or not people have equitable access to opportunities to choose to be healthy. And we can do better for ourselves. We're Iowans. We can bring ourselves back up to where we've been before. You can see that in the 90s, we were hanging around the top 10 consistently. But no one branch of government can do it alone. No one sector can do it alone, and no individual can do it alone. But public health is a problem-solving methodology, and it's got to play a bigger role than it's playing now in the state. And we can make smart improvements by first assessing where we are so we can find a path toward improvement. Finally, IPHA will support policy ideas that promote health, reduce health inequities, and protect groups that have been socially and/or economically marginalized. Examples include, but aren't limited to, those actions that promote health, like funding Double Up Food Bucks program sponsored by the Healthiest State Initiative, or the 5210 program sponsored by the Iowa Department of Public Health. These programs work to reduce obesity rates. Others include access to family planning services and health screenings. These are clinical prevention tools. Improving or modernizing data systems. Protecting a healthy workforce. Reducing tobacco and/or vaping use. Increasing immunization rates over the life course. Encouraging the legislature to use health impact statements to understand the impact of health on laws you pass. Increased access to oral health. Supporting evidence-based COVID-19 response efforts and all infectious disease response, reducing substance use and increasing treatment, like removing the ban on syringe service programs, and increasing the public health workforce, which includes more than public health nurses, also data analysts, communication and education staff, and community health coordinators. In a nutshell, IPHA will support nearly anything that positively addresses the social determinants of health. Social determinants of health are conditions in the places where people live, learn, work, play, and worship that affect a wide range of health risks and outcomes. IPHA will also support and work to protect policies that remain true to public health origins, like preserving community fluoridation, maintaining the status quo on the ban of raw milk, and increasing immunization rates. These are the American traditions of health protection that have been passed down from generation to generation. In the 20th century, they contributed to an increase in the American lifespan by 25 years and continue to be critical to population health. Thank you for listening to this message, and again, you are sincerely appreciated for your service to Iowans. This was recorded by Deborah Thompson, co-chair of the IPHA Advocacy Committee. For more information about this
So I want to point out for the second item, the assessment part of it, the ask for legislators, I don't expect this to be presented in the form of a bill, but the ask of legislators is to have more committee presentations about the health of Iowans, to learn more about the China HIP process, especially in their districts, and then how that will work to inform the overall Healthy Iowans plan at a statewide level once that gets updated with the information. We really just, in general, want legislators to be asking the question, are Iowans healthy? Are Iowans healthy? And seek the answers. Now, I really want to endorse the talking points that I used in this video. This messaging is from the phrases.org website. I think people get a little frozen and gun shy about what to say about public health specifically, because you could say a lot. Public health is a big tent. But this phrases.org project was funded by the de Beaumont Foundation. It's a national public health organization, and they've tested it amongst individuals all over the country. And in fact, one of Iowa's own, Kelly Gertis from the Cerro Gordo Public Health Department, was part of the project. So we're very proud of Kelly for representing the Midwest on this. These three pieces, especially diagnose, cooperate, and prevent, are really digestible ways to explain what public health does to the public and to other potential community allies in other sectors, and also to legislators. So phrases stands for public health reaching across sectors, which is going to be important in the 21st century. I've had half a dozen conversations with legislators about our legislative agenda so far. I've been using these talking points, and they are absolutely resonating with Republicans and Democrats alike. Other points I've used are included on this side. Again, reiterating how public health listens to people in their community and then pairs what they hear with science and data to recognize patterns and problems. Talking about how much money we put into healthcare when people are already sick, and talking about the public health parallel of, or parable of, putting so much money in to save people who are drowning, then the public healther walks up and says, well, why are people ending up in the lake to begin with? And then you just put up a sign to say, hey, you might fall in the lake here, watch out. And then money and lives are saved. Public health is designed to prevent each of us from getting sick in the first place, talking about clean air, pure water, safe neighborhoods, and more, because it's our mission to make sure our cities, counties, and country have what we need to stay healthy. And then finally, the role of convener. Public health experts bring together everyone who has a role to play in their community's health, including schools, businesses, government agencies, and others. This is all from the Phrases website. And again, just summary statements. Just like a person makes decisions that affect their health, so does a community. We need clean air and safe neighborhoods, for example. Public health experts listen to the community and look for patterns in what is affecting their health. They use science to diagnose problems and bring together everyone who can stop health threats before they start. So it's a lot of consistent themes in the messaging said in different ways that will resonate with all kinds of people. So your role as a public health enthusiast, as measured by your participation in events like these, or perhaps by your membership in IPHA, or perhaps about your own personal missions and purpose. We would like for you to continue to look for opportunities to engage. I think that's the one thing Lena has done well this year. Well, I'm sorry, that came out weird. Lena's done many things well this year. For example, the number of opportunities IPHA has offered through her leadership to feel part of a public health community here in Iowa. So we got to start showing up for one another. And starting with our legislative agenda that you'll see focuses on improving the public health system and especially local public health. And in light of their unwavering and dedicated public service to the Iowans and their community, and therefore the state, I think let's show up for them as a community of public health professionals. I mean, they're not off the hook. They have to show up for themselves too, but they need fans and support and cheerleaders. So our role, your role, our role, my role is to share information, respond, and show up. The legislative agenda information, once it's sent out by IPHA, please forward it to other public healthers in your circles. We want the entire base, an advocacy base, to be formed and strengthened and rally around our legislative agenda. Send it to legislators. You can find yours on the legislative website. The newbies aren't posted yet. They will be once they're sworn in January. So you're welcome to contact me or Lena for more information on how to contact those folks and who they are. And then when we send out action alerts, I would implore you to respond to them. Take a second to complete the actions requested of you and know that you're one part of a larger effort, and be proud of that. And then show up virtually. Again, we're going to have a virtual week on the Hill instead of just a day on the Hill, February 1st through 4th. So look for information about how to participate in that. We intend to have a pre-event for the week in the middle of January to talk about advocacy, to talk about legislative issues, and to talk about the goals for the virtual week on the Hill. Come hang out with us on the IPHA Advocacy Committee. We meet a couple times a month. It's a good group, a lot of doers, and a lot of different walks of life of public health professionals. And as you can see, we've done a lot. We work hard. My contact information, and I'm happy to take questions and have some discussion. Thanks for being such an attentive audience.
Thanks, Deborah. I love that video, and I know we're going to get lots of use out of it. We do have one question in the chat already. Let me scroll back up to it, from Representative Eisenhart. Thank you for being with us today, Representative Eisenhart. He asks, or he starts out with a statement that Iowa has a decentralized public health system with lots of latent power in local boards of health. Counties are currently putting together budgets. Can local boards bolster funding that can be offered to leverage greater investment by the state? Any thoughts on that?
Can local boards of health bolster, do you mean like I
think maybe boards of supervisors, perhaps.
Oh, boards
or
of
Representative Eisenhart, if you'd like to clarify, you're welcome to unmute.
Thank you. Appreciate the invitation to be with you today. In fact, I'm trying to track down some historical information on public health spending or investment in Iowa, including by counties. But the question is, what is the current level of investment by counties? Can the local boards approach the counties to increase fund in the for across the board for many purposes in the wake of the pandemic, and then use that increased investment as a case for us at the state level to increase funding to match what the counties are doing?
Okay, I hear you. So that's a two-part question. I'm going to get real wonky on the first part. It is not impossible, but likely a significant time investment to understand how each public health, there's 99, remember, how each public health is funded locally. All of the touchy-feely money gets rolled up into one general fund at the local level. And by touchy-feely, I mean all social services and public health. And so to try and separate out what is DHS, you know, in thinking of that alignment, like child welfare, versus public safety versus public health. Took an intern and I about 6 months for just about 10 counties. We had to contact local auditors and really break down each individual budget. DOM, the Department of Management, which is the state executive branch budgeting office, collects local information, but they've been unwilling to separate out I mean, and I'm not saying because they're mean or anything, they're just, we haven't presented the value of understanding public health versus social services, I suppose, in a compelling way. And so they continue to collect it as one lump amount. So wonky over. Your other question is about power and influence at the local level. And again, I think that's probably a disparate response to each local health agency is governed by a local board of health that's appointed by the board of supervisors. There's a power imbalance because you have a set of elected officials in the board of supervisors and a set of appointed volunteers in the local boards of health. The short answer is yeah, absolutely. They're public health allies to local public health administrators and should be open to advocating for resources to, at the very least, be able to properly respond to the laws that are required of counties by the state. And then because we need better population health, they should be open to doing more for the health of their citizens, and funding is just a part of that. I don't know, they're also not, I don't know how to put this, unionized isn't there, there's not a point where they can all get together and share best practices. There's not a lot of advocacy training on a statewide level for them. I think that there's politics locally that we probably don't respect from a statewide level as much as we could or should. And so those are goals in the future for the public health system, is to start to have more opportunities for people who are in these positions to talk to one another and to have a collegial, have support when they do advocate to boards of supervisors for more funding.
And
just
I'll
make a
add,
quick, if you don't mind, just make a quick point. I've been obviously monitoring the Dubuque County situation now for going on 9 months.
Mhm.
And they're putting together their budget now. The Board of Health request, they met last night. Their heads aren't in the space of, hey, let's ask for what we think we need. They ask for what they think they can get. And so they're afraid to ask for more, but they're in the moral high ground here. And there are definite needs. And so I guess it's as much of a psychological question as a technical question. But thank you anyhow.
Absolutely. And I would say that what we're trying to do with public health, with local public health, when we meet with them every week, is to help them connect the dots. When you say words, things happen. Say more words, because they have had some success, and Chris Essel's on when they show that bravery, and there has not been repercussions. I think that fear is overstated. Lena, you were going to say something.
Yeah, I was going to add to that. I think, if we look for silver linings, a silver lining of 2020 is that people are more aware across the state of what public health is, the role of public health, the importance of public health, and how interconnected we are with everything else. And I mean, I would hazard a guess that most people had no idea that there is such a thing as a local board of health. Probably most people still don't know, but maybe more people know now. But those meetings are open to the public, and the advocacy isn't only at the state capitol; it's in our local communities. It's happening. It's going to coffees that are hosted by the local Rotary Club. It's local boards of health meetings. It's county supervisor meetings, and the more those elected and appointed officials hear from constituents about their concerns about public health, and again, those intersectoral concerns, the more comprehensive those advocacy messages will be, and kind of percolate up and trickle down. And we're trying to do that too at IPHA with different partnerships that we have. Cross-sector partnerships where we talk with people in the transportation sector. We talk with other associations like school board associations, ISAC, and others to say, we know that we work best when we work together. And so let's start walking our talk.
Deborah, this is Cheryl Jones. Can you hear me?
Yeah, I see you, Chris.
First of all, thank you for really saying you're hearing a message for a more conservative audience. I've said for a long time, what you can talk about in Iowa City and what I can talk about in Bloomfield are not the same. It may be the same topic, but the delivery has to be geared to your audience. So I'm really glad to hear you, looking at that. I shared with you, we had a legislative forum, a virtual legislative forum down here in Wapello County. We do it every year. We've done it for 25 years. We did it virtual this year, and it worked well. We had a number of our local legislators who participated very well, and one of the newly elected legislators. But one of the things we talked about, because we do it as a collaborative, we're not there saying, oh, I need money for my organization. We're talking about what have we learned? And one of the things was, what have we learned from COVID? And I did present that. And I said, the most important message we've learned was the importance of local public health. And that was something those legislators could speak to. I mean, Representative Rosenboom from Mahaska said, yeah, our Mahaska County folks. So seriously, folks listen. And we were very much engaged. And we have a newly elected representative here who participated in that. And then I met individually with her. So there's huge opportunities to do this. But you're right, the message of public health is a universal message, and we have to do a better job of getting that message out in our rural parts. I mean, when you show the red part of the state there, the outcomes, well, Chris, that's where we are. We commiserate, but I'm just saying, we have real issues here, and we need to, how do we work with this, and how do we work with our elected representatives to do this? So thank you for what you've done. Helping us craft these messages is so crucial. We have to be singing from the same hymnal. Maybe we use a little bit different approach to how we do it, but our message has to be consistent. So this is an incredible resource. And I will say I'm a proud member of IPHA, have been for quite a while.
Yes. Chris, I saw you wanted to say something, but before, I'm developing some materials for IPHA to put on their website as part of a contract I have that speaks to having different richer messages, speaking to morals on a political spectrum. And I'm hoping that that will be helpful for you folks in rural Iowa. Chris, what were you going to say?
I was just going to mirror what Cheryl said. Thank you very much for all that you've done to continue to help us at the local level. And we have to speak up for ourselves. For those of you that don't know me, I'm Chris Estel. I'm the Jefferson County Public Health Nurse Administrator. And yeah, and the other thing I wanted to speak to about local budgets, that I am a nurse. I'm not a CFO. I am not a financial advisor. But I've heard our supervisors speak numerous times about the cap that they have on their budget as total growth, so that they have to look at that, and they can only raise the county's budget by so much of a percent. And I was thinking it was like 2%. And I don't know, I can't speak to all that, but when you're looking at the county budget and all of the departments are going to the supervisors for their funding, yeah, it gets to be very, very challenging. And I just want to mirror that, public health is doing a great job. If we don't hear anything from public health, they're silently working. Well, we cannot be silent any longer. So it's important that we are all on the same page. And I am very glad to be part of this. And I cannot thank you all enough for listening and supporting all of us at the local level, because it's been a challenging year and we're not through it quite yet. So thank you.
Thanks, Chris. Oh, thank you. You're a rock star.
Other questions, feel free to type them in the chat or unmute yourself and turn on your camera. And between Deborah and I and Chris and Cheryl, who have local expertise, we'll do our best to field them. Otherwise, we're going to keep plugging IPHA membership. Louise, I see you've unmuted. Are you trying to say something?
Yes. First of all, I just can't get over how important the China HIP process is. It's so fundamental, guys. It's so basic. It's so democratic, or should be so democratic, in which people are pulled together from all different groups to decide what's important. The one thing that I've noticed is I've gone through it all, and that is that when they come to prioritizing what's really important, what they think of is, do we have the money? Do we have the resources? And that's the part that's missing. You can't work in housing or transportation. Yes, you can do it with other people and other agencies, but you've got to have the money, honey. Very important. So the message is quite clear.
Thanks, Louise. And that time we went down the rabbit hole of local budgets, I'm like reliving the stress moments. We didn't see necessarily for what we were able to do with a case study that we developed for Garrett when he was director at IDPH. We noticed a relationship between increases in public health investment and doing better on county health rankings. There's not necessarily a magic number, but there's definitely evidence that suggests the more you invest in prevention, the better your health outcomes will be. Legislators I've spoken to already about our agenda include Senator Costello, Representative Bergen, Representative Eisenhart, and I talk all the time. So I'm sure I've told him about it too. Representative Sunday here locally from West Des Moines. John Forbes from Urbandale. I mean, it's all been well received. I know it's easy to say a conservative minded group of legislators may not want to invest. I just don't see that. I think they're willing to invest something if we keep up the drumbeat. And that's even having missed kind of a window of opportunity to get into the governor's budget. I'm a little skeptical that we'll achieve that, which does make it easier when you have an appropriation request. But I just think we have to give them the benefit of the doubt that if we keep talking to them and not give them the out that they didn't hear from anybody about these issues, that we will achieve some success and small victories. It can all be incremental. That's okay with me. We're also developing a really great relationship with Interim Director Kelly Garcia and Beth Skinner, the Department of Corrections. They both participated in our forum. So, I just want you guys to be aware of the momentum and participate in it. And in return, we are happy to be an ally for you too, as best we can. And we're looking at ways that we can increase our bandwidth so that we can support our other nonprofit allies. Like I see Roxanne Kogel's on here at the Epilepsy Foundation. There's so much good work going on in Iowa that does need support. We want our relationships to be reciprocal and share in the public health that's going on.
I'm glad you brought that up, Deborah, because I was going to mention that the Mid-Iowa Health Foundation Health Connect Fellows, I see a lot of my fellow fellows on here, and we're all we're united in our equity lens. We each have our individual topics, whether that be agriculture, children's mental health, education, but that the connector is equity. And when we work together, even on the areas of our work that overlaps, and we can amplify each other's messages and make each of those voices, our collective voice that much stronger and that much more impossible to ignore. So I'm happy to see the cross-sector interest that we're growing as well. We did have one other question that came in. Again, from Representative Eisenhardt about whether or not boards of supervisors have to approve the China HIPs. Deborah or Louise, I'm not sure.
Yeah, I actually want to defer
answer that question.
Yeah. And first, Selena's comment, I just think that collectively we need to start agitating for a culture of health in Iowa, where health and prosperity are intrinsically linked. I think that's something that we can all have shared purpose on as we talk about health issues in Iowa. Louise, do you know, I would assume the local boards of health have to approve the China HIPs, but I'm unclear if board of supervisors have to approve them too. Do you know? Are you still on? That might be a question we need to follow up with you on. Okay, so Chris said our board of supervisors does not. Yeah, I don't recall that being a requirement.
But it's certainly an interesting idea for them to be involved in the process, at least suggest or have a review.
Okay, so Representative Eisenhardt was suggesting that as a practice. Yeah, we're looking into ways. We've reached out to the Iowa Association of Counties so that we can figure out ways to better collaborate, to have our local boards of health and local administrators collaborate and form relationships better with county boards of supervisors. There's a lot of work to do towards that.
I want to be conscious.
I think I am now unmuted.
Oh, sorry.
The question, I tried and I couldn't do it. But
that's okay.
What we do ask is that the Board of Health approve it. But as far as the boards of supervisors, I think that's an entirely county matter and a Board of Health matter. Does that answer the question? I think it's a great idea, but it's something we don't require.
Yeah.
Great.
Thanks,
well, thank
Louise.
you for that information, Louise, and a great suggestion, Representative Eisenhardt. I do want to be conscious of the time. This is meant to be an hour-long webinar. It's supposed to be, something that you can enjoy and learn and share while you're enjoying your lunch at your desk or wherever you are on these virtual days. We do meet every month, the third Thursday of every month, to have a presentation and to share what we've learned and the work that we're doing across the state. Next month, the third Thursday falls on January 21st, and we will be talking with Mary Kelly, who's on the call today, and Jessica Williams about oral health and understanding public health dentistry in Iowa. And I must say that, you know, I've got 20 plus years of public health, but before I met Mary and Jessica, I never really considered the dental side of public health. So I am grateful for what I've learned from them and know I have so much more to learn. So I hope that you will join us January 21st. That's the third Thursday at noon. The same same web links. Feel free to join us again and bring a friend, bring your lunch. And as again, I'll just reiterate, as a nonprofit organization, IPHA does rely on your membership dues and our sustaining donors to support our mission. So if you're not already a member, we look forward to welcoming you as a member. And if you're a student on the call, I know we have a lot of students here today, check with your department chairs, because many of the departments at universities have funds to support professional organization membership for students. So we look forward to seeing you again here next month. If you have questions about this presentation, feel free to reach out to me or Deborah. You can reach me at lena@iowapha.org and find out more information about our work at iowapha.org. You can follow us on Facebook and LinkedIn and Twitter and all that good stuff. And we hope you have a wonderful end of your year. We know that this has been a COVID coaster and that will continue, but there is a faint light at the end of a very long tunnel. And we are grateful for all the work that all of you are putting in day after day after day. So thank you, and we'll see you next month.